Hello everyone, I am Kritika Rajput and today I will be presenting an overview of mycetoma, focusing on its types, causes, symptoms, diagnosis and precautions. This is a serious disease that affects many people. So let's start with the introduction. Mycetoma is chronic granulomatous disease, which means it leads to the formation of small lumps and granules in the body. It usually affects the feet. The disease was first described by Gill, 1842, in Madurai, South India. It causes infection in skin and tissue. This is a picture of a foot affected by mycetoma. Then, the other names of mycetoma is eumycetoma, Madura foot, and Madura mycosis. Then its types. There are two types of mycetoma, eumycetoma and actinomycetoma. Then their causes. Eumycetoma is caused by various fungi like Medullera, Mycetomatis, Pseudoleschera species, and Exfoliella species. This is a microscopic image of eumycetoma. Then next is actinomycetoma. Actinomycetoma is caused by various bacteria like Actinomycetes, Actinomedulla, and Streptomyces. This is a microscopic image of actinomycetoma. These fungus or bacteria enter the body through small cuts and wounds. Then, the environmental factors that causes mycetoma. The infection usually comes from soil and plant debris and contaminated materials, which is why people who work at agriculture are more at risk. Then, these pathogens enter through minor skin injuries and cause chronic infections. Then its symptoms. There are three stages of symptoms. First is early symptoms. Early symptoms include small nodules or lump on the skin. These nodules can go over time and become painful. As you can see in the picture, nodules have formed. Then next is progressive symptoms. As the disease progresses, pain and sinus tracts occurs that drain pus. This can lead to deformed body parts, especially in the feet, as you can see in the pictures. In advanced symptoms, the infection can even spread to the bones and causes pain. Then next is diagnosis. Madura foot is diagnosed by white, yellow, red and black granules. You can see in the pictures, granules are visible. Then next is diagnosis involves clinical examination where we look for visible signs like nodules or pus damage. Then microscopy. We can also take a sample of the pus or tissue and examine it under a microscope. Then culture tests are done to grow the fungus or bacteria from the sample to identify the cause. Then X-ray or MRI scans help us to see if the infection has spread to the bones. So the next is precautions. Preventing mycetoma is following some basic precautions like regularly washing your hands and feet, especially if you work in area with a lot of soil. Wearing protective clothing like shoes and gloves can reduce the risk of injury and infection. If you notice any skin lesions in your body, then immediately seek medical attention. Then its treatment. The treatment for fungal mycetoma is antifungal medications like itraconazole, terbinafine, etc. Yeah, that's all. Thank you.